So we turn to communities, collaboration, and patient-centered care. So one way that communities can impact health is positive, or they can affect it negatively, or it can be quite neutral. Communities such as that in Salt Lake City, Utah, have some of the highest adherences to their diabetes on the planet. And so that community is being studied as to what are we doing right there? What about that community makes it right? What about what doctors and nurses are doing with patients? How are they collaborating, and how are they centering that patient care with those communities in mind to make that work? That being said, that there are a lot of things that are out there that aren't going right, and we do need to put some more focus on. And so some communities have problems with different things. So how do we approach these things? Well, we can approach them from the community, from collaboration with both leaders in the community and with medical personnel within the community, and then provide patient-centered care, incorporating the patient in that process of making a regimen that works for them and their culture. So when we move on, we like to move into this idea of drugs of abuse. Many communities have problems with drugs of abuse. There are terms that we should know, things like abstinence, so staying away from the drug and or the behavior altogether. A relapse, which is if somebody was off of the drug for a while and then goes back onto it. Drug addiction and tolerance, which are different. We'll explore those in just a little bit. Craving, and cue-induced craving. So whether it's just physiological or just psychological, or a combination of the two. And then physical dependence, which is a dependence that is there when you take the drug away. That person has some sort of a withdrawal, and the withdrawal is physical. You can definitely see it. Drug misuse, which is using a drug not for its intended purpose, and then drug abuse, which ends up using a drug obviously beyond its intended purpose, but also it is negatively affecting that person's functioning in their life. Addiction is a tough one to look at. We're now realizing that with some of these addictions, the pleasure center or brain reward system is activated within the brain. Dopamine and other neurotransmitters are involved. So there are stages of addiction: intoxication, detoxification, withdrawal syndrome, cessation, and maintaining abstinence. So intoxication is that state of being influenced or affected by a drug or other toxic substance. Detoxification is treating an intoxicated patient to diminish or remove drugs or their effects from the body. Withdrawal syndrome is a group of signs and symptoms that occur in physically dependent persons when the drug is stopped. The symptoms are often opposite the effect of the drug produced before it was withdrawn. Cessation and maintaining abstinence is treatment with other drugs that may be used to decrease craving and prevent withdrawal syndromes. Stimulants are things that are not only in the news, but are quite rampant in our country. Things like nicotine, cocaine, methamphetamine, caffeine, and then some bath salts. But some bath salts can be both stimulants and depressants. Those are a long story. Nicotine, most rapidly addicting of the drugs of abuse. Side effects and adverse reactions include marked cardiovascular stimulation and increased myocardial oxygen consumption. The general CNS stimulation, increased respiratory rate tremors, increased alertness and arousal, increased GI secretions and smooth muscle tone, and promotion of relaxation and relief of anxiety. Physiological dependency involves the withdrawal symptoms of nicotine, can occur within the first few hours. They peak in 24 to 48 hours, and they last for a few weeks to several months. After withdrawal subsides, cue-induced cravings may cause smoking treatment, nicotine replacement therapy, or other smoking cessation agents. Depressants include alcohol, barbiturates, benzodiazepines, and opioids, and overdose with these can result in decreased respirations, which is the biggest one. Other drugs of abuse include cannabis, psychedelic drugs, and inhalants. Cannabis has been becoming more and more of a problem. So we do look at how to recognize the impaired health professional, and this is actually a very difficult thing to do because healthcare professionals that can be impaired are often good at hiding what's going on. I'm just going to play this short video.
I took it for the first time just to see what would happen.
All it took was one time for me to be addicted.
At the end of that time, I was taking about 500 milligrams of opiate narcotics.
Looking back, there was nothing about my day that was safe.
I worked impaired every day for over a year and a half.
It's amazing to me that I was not caught.
At that moment, I had basically just given up all hope, and I just thought that I would overdose and somebody would find me or I would die.
Healthcare workers addicted to prescription drugs. It's an issue impacting more than 100,000 doctors, nurses, and other medical professionals each and every year across the country.
I spent 9 months active in my disease, and nobody suspected anything.
Anita Bertrand is part of that statistic. As a nurse anesthesiologist in Houston, Anita had no history of drug use before she got hooked on pain medication following an abdominal surgery.
People's lives were in my hands. I put this person to sleep. They're asleep and having surgery. And I'm thinking about, when can I get some more narcotic?
Before she knew it, Anita had resorted to drug diversion, the official term for stealing drugs. It got so bad, Anita even put an intravenous port into her ankle to inject drugs more efficiently.
Addiction to opiate narcotics really sucked the life out of me in every aspect of my life. In the morning when I got out of bed, I felt like an 80-year-old man. I was in my early and mid-30s, and literally it hurt every step that I took.
Stephen Lloyd turned to prescription painkillers to deal with stress.
So I'm actually going to post the rest of this at the end of my final playlist here. But it is an interesting video. Have a great day, and best wishes on your final.